Hi, I'm Catherine Pack, Senior Fellow with the Australia Chair at CSIS, and I'm here with Dr. Eileen Natuzzi to discuss our recent briefing, Prioritizing Health System Development in the Pacific, a Layered Approach. We're also joined by Sir Colin Tukuitanga. He is Associate Dean and Associate Professor at the University of Auckland. Thank you both for joining us today.
Thanks for having us.
So Eileen, let me turn to you first. Scoping out a little bit, you and I have been discussing the challenges of health system development in the Pacific for quite some time. But I think the genesis for this briefing really came out of our mutual frustration that despite the plethora of activity going on in the region in health system development by many partners, health indicators in the Pacific have not really gone up and in fact, in many cases have gone down. So could you describe a little bit some of your experiences as a physician in the region and working on some of these issues and the challenges that led you to conclude that there really is a need for a policy shift in the U.S. on health system development?
Yeah, thanks, Catherine. You know, I've worked in the Pacific region for almost 20 years now, in particular in the Solomon Islands, which I think probably has one of the toughest health systems to sort of bolster up. The biggest problem, I think, in the Pacific region is we're dealing with, thousands of islands across 30% of the Earth's surface in the Pacific. So there are access issues. And there's commitments to long-term development issues. And I think the reason why I really wanted to write this paper with you is to be able to make U.S. government policy people aware of the multitude of areas where a health system can be strengthened. And I think Sir Colin's paper did something very similar, where we look at health workforce. How can we strengthen the health workforce so that people are happy, smart, well-engaged, adding new treatments and therapies within the Pacific region? I think the other thing is, when you look at the universal health coverage and how Pacific Island countries are doing, we can see where siloed a specific disease and entity programs were focused. Those are doing better at achieving universal health coverage than, let's say, non-communicable diseases. So for me, sometimes I look at the Pacific and I think, in our good conscience, how can the U.S. not be strengthening, offering some of the medical expertise, our universities, strong universities, as a way to help strengthen the entire Pacific region, including the territories, the freely associated states, and the non-U.S. affiliated Pacific Islands. So I think that is sort of the overall message that I'm hoping gets across, is that this is an area where a concerted effort of multiple development partners can make a huge difference. We just have to come together to do it.
Yeah, I completely agree. And could we pull up figure 1 for a moment, because I think this goes to much of what you're talking about. The health expenditures per capita in selected Pacific Island countries and territories compared to, and we also have on the graph here, US, Australia, and the world. As you can see, it's pretty striking, the differences.
Yeah, I mean, if you take the averaging, so if you take the territories and the freely associated states, the average health expenditure is about $900 US. And for the region, it's about a little over $500 US per person annually. For the non-affiliated Pacific Islands, it's $328 US per person. That doesn't suggest that the health system is incredibly efficient. It suggests that the health system, just as Sir Colin's paper pointed out, is underfunded. And a large portion of this is because we're dealing with small economies. And so it's a matter of scaling what happens with health to those small economies.
Sir Colin, thank you again for joining us from New Zealand, as you are for your morning. Earlier this year, you co-authored a report that Eileen was referencing earlier, and that we also referenced in our briefing, on the sustainability and resilience of Pacific Island health systems. And it focused specifically on Tonga, Vanuatu, and the Republic of the Marshall Islands, but I think many of the findings there are applicable across the Pacific. So really curious how you look at the briefing that we did in terms of recommendations for partners like the US and Australia, and how those recommendations may or may not fit into the framework of overall health resilience efforts in the Pacific from your vantage point.
Well, firstly, thanks very much for having me. This is a very important topic of conversation. I commend you both on your paper. Just briefly, the Pacific Island states, as you point out, small economies, limited resources for health, and to continue to expect them to generate additional money for health services improvement from domestic sources is unrealistic. In other words, we need to look at other ways of supporting it. But fundamentally, because of the involvement of governments in health systems and the small amounts of money dedicated to health, that's the fundamental problem, and it leads to old facilities not being upgraded, old equipment, strained workforce, and so on. So I think your paper is an important trigger for renewed conversation, because the small island states in the Pacific inherited these health systems, health infrastructure that was really designed for infectious diseases, curative focused medicine and healthcare. Of course, the problem these days is chronic non-communicable diseases that don't really need these facilities. They need something else. And of course, on top of all of that is the strain, additional strain I call aggravating factor caused by the climate crisis. And in Eileen's paper earlier on, they looked at facilities, most of them, many of them, old. They're located on the coast and extremely vulnerable to climate change. So lots and lots of challenges. And that's why I think the paper you produced is a timely intervention, because I think we need to revisit the conversation and think about how do we reshape what's needed to truly ensure a resilient health systems. By the way, we chose Tonga, Republic of the Marshall Islands and Vanuatu, really to reflect the region. Tonga in Polynesia, with the challenges that we described. The Marshall Islands, more closely aligned to the United States, of course. A sizable contribution of share of GDP spent on health, but not really achieving outcomes that we would expect for that amount of money. Vanuatu, on the other hand, of course, Melanesia, particularly resource poor, very low spend of GDP on health, and as a consequence, we see what we see. So in a way, the papers that we produced and yours are really reinforcing each other and calling for some rethinking, some as you point out in your briefing, we need to look at this, and the climate crisis, of course, will aggravate things if we don't step up and look at this more closely.
And I'd like to dive in a little bit more to the human resource issue, but first, could we pull up Figure 5, because you mentioned climate and the susceptibility of hospitals, and this really struck me, and I know, Eileen, you've done a lot of research on this as well across the region. Percentage of hospitals per country located less than 300 meters from a hydrological threat. And this just really reinforces that we all need to think about infrastructure, resilient infrastructure building and maintenance in the Pacific in a completely different way. Just really reinforces, Sir Colin, what you were saying about climate change being that additional factor. But I'd really love to go back to, in your paper, Sir Colin, you also talk about the challenge of health human resource. And that's something that Eileen and I get into our paper on as well. I'm curious your thoughts on the challenge of the brain drain, right? We talk about that a lot. You have a desire to give exceptional opportunity for doctors and nurses across the region to advance their clinician skills and to be able to allow the human resource capacity to grow in each country. But then how do you keep that human resource capacity from then moving to another higher paying job elsewhere? And I'm curious your thoughts on that and what you've seen in your own studies across the region.
Yes, it's a particular problem and not a new one. Of course, the Pacific Islands have struggled with the loss of trained health personnel for the longest time. I should also say that New Zealand, right at the minute, with all its resources, is struggling to find health and retain healthcare workers. So it's a global issue, not new in the Pacific. It's important to point out two things. One is, in Melanesia, by and large, the problem isn't so much loss overseas, out-migration. It's because they're not training enough people. Mm-hmm. So in Vanuatu, for example, given the resource constraints, they had to shut down their nursing school, which I think was unfortunate. Nurses everywhere around the world are the backbone of healthcare. And if you're not producing enough nurses, you're on the back foot. And so I regard that issue of not training enough healthcare workers as a particular problem, largely in Melanesia. The brain drain, we're now wanting to call it the brain circulation, because we want to think about having people circulate as opposed to recognize the fact that this is a global phenomenon. People are going to want to move. They have human rights that need to be respected. You can't restrict people who want to move and so on. And we've got to be much more imaginative about how we do this. In the case of Tonga, as you may have seen in the report, for a number of reasons, they've been able to retain quite a lot of their, particularly doctors. And Tonga, for the longest time, my friend used to say he trained enough. He was Minister of Health. He trained enough, but he loses half of his doctors. But somehow they've been able to retain them. So that's why we're talking about not so much trying to prevent people from leaving, but to enable people to circulate, to incentivize people to stay or at least circulate or come back home, if not long-term, certainly to help out. In other words, this idea that we could restrict people and limit them from leaving is outdated and ineffective. We need to be much more imaginative, as I say, because it's a global phenomenon. So the workforce issue is a big deal in these islands. I'm also a fan of independent nurse practitioners. Politically and in the public view, they prefer doctors. Doctors is what they want. But actually, if you look at the evidence, well-trained independent nurse practitioners can deal with pretty much a lot of the things at the primary care level, and particularly in small island states, in outer islands, in rural areas where it's difficult to retain doctors. I think independent nurse practitioners and other categories of healthcare workers is something worth thinking about. So this is why I think your paper and the opportunity that it provides help us to rethink, are these facilities the kinds of things we want going forwards for the types of health problems we're seeing? Are the healthcare workers that we currently train really what we want and need going forwards, or do we need something different? That's why I think your intervention, your briefing is really important.
I love that idea of brain circulation, brain drain, and this idea that, like you said, instead of the idea of keeping people somewhere, how do you incentivize them, right? Because it is a human rights issue to allow people to move and to move throughout the globe as they might want. Eileen, I know this is something you've also been keenly watching in areas like the Solomon Islands and elsewhere, this idea of human resource capacity and how to keep doctors and nurses and continue to train them in ways that is most effective. What are your thoughts on the human resource issue?
I've spoken with so many physicians and nurses that work throughout the Pacific Islands, but, predominantly doctors and nurses in Solomon Islands. I think that the kind of brain drain or circulation issue is partially due to working within a health system that doesn't value them or that they feel unvalued. And I was really struck. I participated in the Sasakawa Peace Foundation Pacific Island Nation Week, and I had a chance to talk to providers from Tonga, Samoa, Cook, and each one of them said, our physicians and nurses are suffering from burnout. Burnout is a term that we hear frequently here in the United States about sort of the feeling devalued, depressed, and overworked and whatnot. And so I think that if there was a magic bullet and everything that we outlined in our paper was begun to be laid in place in the Pacific Islands, health systems began to become elevated, the devaluation or that kind of burnout among my colleagues in Honiara, in other parts of the Pacific Island, I think that would dissipate. And I think that would certainly contribute to their wanting to stay in and continue working home. I think if we offer additional training, continuing medical education training, so they skill up and feel like they can do a better job in taking care of their patients, support for that skill up as well too, then they're not alone in the game. We are a partner with them, and I kind of see our endoscopy training program in the Solomon Islands is almost a model for that. The Ansgita Association has been training Pacific Island doctors to do endoscopy. It fits into universal health coverage because it diagnoses cancers as well as other GI diseases. And it is really empowering, I think, for the doctors that take on that additional skill set. And so, what we do is we go in and we do training in country, and then some of their doctors come over to Australia and do training there. So I think that when we create partnerships like that, value goes up. The workforce feels like we're not in this alone. We've got this group that's gone, we have these partners that are working with us. So like I said, I was really struck by hearing about burnout, using the term burnout among Pacific Island doctors and nurses.
I think bolstering the human resource capacity also gets at another challenge, and as we talk about in our briefing, reframing the way the U.S. and others are thinking about provision of healthcare services. Instead of bringing in our own doctors periodically or bringing in certain medical capabilities, building up the host nation capability and how critical that is as a piece of the overall pie here. Sir Colin, I am curious, and thank you for all your kind words for our briefing and how it fits so well into the research you've done. Is there anywhere that you think we missed? Is there any key parts of where you think the U.S. and Australia and other partners need to be focused, or anything that you think we need to double down on a little bit further or amplify from our report?
Yeah, more amplify and highlight and focus on implementation. I'm a bit long in the tooth in this business, and I've heard quite a lot of this before, and I'm sure Eileen's the same, and you get a bit, there's a word here in New Zealand called hoha. You get a bit frustrated with it all because you heard it, but nothing seems to happen. It's not so much you're missing anything, it's like, how do we actually make it happen? So, for example, technology, I think we've talked a lot about, and it offers a lot of potential, particularly because we should de-emphasize the focus on facilities, buildings with beds near the coast. But think about the changing epidemiology, disease burden in the region. We know that's largely chronic diseases, and how do we deal with those? So technology offers real potential, but not quite implemented to the extent that it needs to be in two areas. One is to provide, obviously, telehealth, telemedicine, clinical care and advice. And in our report, we referred to the wonderful example in Tonga with the pathologists from Australia supporting young pathologists in Tonga. The other is professional development opportunities for the islands, and we've been doing a little bit of this on and off, but not resourced and supported well enough. By that I mean specialists of different variety, different specialties in Australia, in the US, and New Zealand, and elsewhere, provide ongoing professional development support remotely and training, ongoing education to the small island states. You know, people make a big song and dance about salaries. Yes, salaries are important and they generally are lower in the islands. But these are professional people and ongoing professional development, feeling a sense of solidarity and support with their colleagues, particularly because often these folk are on their own. There's only one psychiatrist in Samoa. And I think this opportunity to enable, to support collegiality and ongoing professional development, as I say, it's not all about salaries, it's often about professional satisfaction, collegiality, solidarity, being able to check in with a colleague on a particular issue, you know, how to better support them where they are. The final thing I'd say on workforce is that the Pacific Island countries have long since worried about sending medical, nursing, health people off island to Australia or New Zealand or to the UK or the US, because the experience is a number don't come back. And so their preference is to try to have people trained as far as possible within the islands, and to have specialists visit either in person or remotely, as opposed to taking people out of the region. You do, of course, need to do this every so often, but with a clear plan that folk feel supported once they go back home. I think that's important to try to ensure that training and ongoing support is done largely at home, if you like.
And I was struck too, and this goes back to, again, the training of human resources, the ongoing professional development of nurses and doctors, going back to the idea of NCDs and how that's such a key problem in the region. Could we go back to figure 4? And this figure really amplifies this idea that I think a lot of Americans especially, or a lot of the US government, when we think about medical provision of health services to the Pacific, or globally, frankly, we're thinking about pandemic response, we're thinking about communicable diseases, whereas in the Pacific Islands, the key killers really are diabetes, heart disease, cancer, emergency room visits from accidents, and just basic health services not being able to meet that capacity. And as Eileen points out in our paper, you know, there's a discussion with a nurse in Solomon Islands who deals with diabetes and yet doesn't have basic follow-on diabetes care that nurses need in that region. And that's just so critical, again, as you say, for that professional development and being able to support the human resource capacity in the region. So Eileen, I'd love to ask you what your main #1 key point, if someone asked the #1 key point out of this brief that you want to make sure the US government gets when it comes to how the US and other major partners should think about the provision of health system development in the Pacific. What is the #1 point that you want people to take away from this briefing?
You know, I think that I really hope that this brief opens people's eyes to the fact that the Pacific isn't just these idyllic islands with palm trees swaying in the breeze. There are real significant threats. There are real significant issues. For more than 10 years, I have been lobbying for health as diplomacy, as part of our diplomatic tools in the US, because if you look at the last 10 presidential elections, within the top 5 issues that Americans vote on, it's health. Health touches every one of us. And it touches the Pacific Islands, and it touches it in that triple threat way. Communicable diseases, non-communicable diseases, and injuries and accidents. And so I think my big wish, and I'm kind of as somebody in public health, going to go out on a limb here a little bit. I believe in prevention. I believe in primary prevention. But I think of diseases as a raging river. And primary prevention keeps people from falling in the river. But of the people who fall in the river who already have diseases, what do we do? What if they're our aunt, our mother, our father? Do we simply wave at them as they go by? Or do we also implement secondary and tertiary prevention, which means care and treatment? That could be surgery, it could be palliative care. Those things, I think, also need to be, they're more costly, but I think they need to be built into a health system within the Pacific that is really going to impact that red blotch of non-communicable disease problems on that heat map that we just looked at. So that is my wish, is that we build things out to include primary, secondary, and tertiary care in a region that has basically been somewhat underserved in developing health systems. And yet all the ingredients are there. We just need to partner.
Yeah, it's really, in terms of what I want people to really take out of this, it's that there's, yes, so much going on. And if you talk to anyone in US government or Australian government or others, they will point to a lot of initiatives, certainly, and a lot of resources. But as we point out in our briefing, without a comprehensive, holistic approach and a coordinated approach between partners, so many of these individual initiatives just simply aren't as effective as they could otherwise be. And in many ways, actually end up in a zero sum for the various locations that they're trying to service. And so much more could be done with what resources are already being committed, and then of course more resources are needed across the board. Before we wrap up, Sir Colin, any other thoughts you have on this briefing and where the U.S. government maybe should start prioritizing? Again, if there's one key aspect that this administration or the next administration should focus on when it comes to health system development in the Pacific?
Again, thank you very much. Firstly, to agree with Eileen that the folk in the river need a life saver. And we know from international evidence that effective, reliable, consistent treatment of hypertension, of diabetes with proven medications reduces morbidity and mortality. And that's not being done at all and well enough in the region. There's not a regular supply of medication. Pharmaceutical budgets are too little for the need and so on. So I agree. I think there needs to be some focus on secondary prevention, particularly because these treatable conditions are so amenable to proven cost-effective, low-cost medication. If there is one thing I would like to see, it's perhaps the US and Australia and New Zealand using their convening powers to bring these partners together for a conversation, an update on how best to work with and to support the island states. I do think there's plenty going on. There's people who go in and out of the island nations doing their thing as per their brief and interest, agencies showing up in Vanuatu after the cyclone to wave their flag about how good we are to do this, that, and the other thing, but actually at the end of it all, it doesn't really help the small island states. And my wish, I recognize how difficult coordination is because, you know, politically, funding sources, expectations, and so on are so varied. But I think if the US can use its convening powers to bring this conversation together and to focus on whatever it is that we collectively agree we have the most impact, whether it's workforce or redesigning health systems delivery or ensuring consistent availability of medication, whatever it is, because the problems are so varied across, but shared in many ways across the small island states. I think a conversation about how best do we apply the resources that we have, because there's actually quite a lot of resource. It's just not used efficiently or effectively in my view. And I think the work of my colleagues in the Capri Foundation on resilient health systems, the work you're doing, I think if we can bring all that together and perhaps encourage those who can influence things to look at it that way. My overwhelming thought is the health systems, apart from the fact that they're located in vulnerable places, is outdated and inappropriate. We don't need these facilities. Yes, you do need some beds, no question. But the overwhelming thing in my view is to redesign a health system, think about technology, think about using non-clinical people for some roles, think about using independent nurse practitioners. In other words, to completely rethink the way health systems are structured and delivered in the small island states, because it's clearly unaffordable, costly, unaffordable, and largely inappropriate in terms of the changing epidemiology and the burden of disease in the small island states.
Thank you both so much for joining me here today, and thank you for your time. Sir Colin, again, dialing in from New Zealand. To read the entire briefing or for other key analysis on global events, please go to csis.org.